Hello, my informative speech topic is attention deficit hyperactivity disorder. It's something that you have, not something that you are. My specific purpose today is to inform you on what it is like to have ADHD. By the end of my speech, you'll be able to identify 3 core symptoms of ADHD. This is my visual aid 1. This is how I feel every day. As most of you already know because you work with me. So, the 3 core symptoms are inattention, hyperactivity, and impulsivity. The purpose is to provide a detailed description of what ADHD looks like, give an explanation of what the disorder is as far as symptoms, causes, treatments, and the demographic and economic relationship to these things. All right, as I stand before you today, you already know that I have ADHD, which is not always so fun. It's like having all of the scenarios playing in your head at one time. Yes. In other words, it would be better understood if people would educate themselves instead of passing judgment on people. It is a neurodevelopmental disorder which occurs in the region of the prefrontal cerebral cortex of the brain. Visual aid number 2, the brain. Neurons that are supposed to transmit information from neuron to neuron do not always work. Sometimes the receptors get blocked, the messages get mixed, and therefore ADHD happens. Not so much fun, but it is, the neurotransmission is responsible for motivation and attention in your brain. So if those receptors are not firing properly, hence ADHD. All right, the exact cause of ADHD is unknown still, but there are environmental factors that can come into play. First of all, visual aid 3, smoking while pregnant. Not so fun and not good for the baby. Low birth weight can be a factor, socioeconomical disadvantages, as well as exposure to lead, which most of the younger ones here don't understand because you guys didn't have lead in your time, but we did. Yes, we had lead paint in the walls, and in your crib you would pick at the walls and eat lead paint, little chips, and hence lead poisoning. All right, now that we've identified some of the contributing factors, let's explore some of the 3 core symptoms that I had mentioned in the beginning. Inattention, which is difficulty to paying attention. It is also often the most leading factor to making mistakes and losing things, such as keys, which we all know somebody in the office that does that quite often. Hyperactivity, trouble with restlessness and inappropriate timing of climbing on objects around the room. This is most often seen in children. Of course, some adults have this problem too.
Kind of like a monkey.
Yep. And they often interrupt conversations.
Like Rena just did?
Like I do too, a lot. And impulsivity, which is your impulsiveness, and you frequently blurt out answers. So if you're feeling any of these symptoms, you may want to consider talking to your family physician.
Rena, I will get you on the schedule.
Explaining treatment options. There are the traditional therapy methods, there are medications, and alternative methods of each of these. No single remedy works best for everybody, but there are these options. Therapy, psychotherapy, and behavioral therapy, as well as social skills training, are among the most popular, especially with young children. It's kind of hard to teach an old dog new tricks, so older people, older adults, it's a little harder. Kids, though, if started early enough, it can work. The contingency theory, which is rewarding good behavior and extinguishing the bad behavior, will also help, but again, is the results best seen are in children, not so much adults. Medications, stimulants versus non-stimulants. We all know somebody that is taking Adderall, and if used in combination with therapy can be pretty much effective. The stimulant drugs target the dopamine receptors in the brain that help emotional responses to movement and motivation. And they're highly controlled by the DEA, which means that they are a Schedule IV drug and they have a high risk of abuse and or dependency. Non-stimulants in combination with therapy differ because they target the non-epinephrine receptors. They produce a therapeutic effect, which helps control executive functions, such as impulse control and starting tasks. These are drugs such as Strattera and guanfacine. All right, outdoor exposure in studies has helped a lot of people with ADHD. Visual aid, green spaces. The more time you can spend outside, the better your life will be. Sometimes being cooped up in offices all day is not good for people with ADHD. And always discuss treatment options with your physician. Understanding the demographics and the economical relationships associated with ADHD. They used to think it was just a young white boy's diagnosis. This has since been debunked. Every ethnicity and every race across the world deals with ADHD. American children between the ages of 4 and 7, the percentage nearly rose 43% between 2003 and 2011. That's nearly 6 million children diagnosed every year with ADHD. Yeah, adults, it's getting higher too, but not quite that high. Predominantly, as of now, women are the least diagnosed with ADHD. Believe it or not, a lot of them are walking around undiagnosed, which means that they are untreated. A lot of people think that they're bipolar, or if they're married, their husbands like to say that they are crazy, when really they have underlying issues that they just haven't resolved yet. And as far as income, a lot of the children that are on public welfare assistance, as far as insurance, they have the highest risk of being diagnosed ADHD, and I'm not exactly sure why that is. But private and commercial insurances, they are a little bit less at 8.6%, and the uninsured fell to 5.7%, which that could be in combination with the fact that medication is expensive. Hence, the doctor's appointments are expensive, and they can't afford it. And that was according to a report in the CDC. Worldwide occurrences, like I said, they do happen all over. So this is, again, another visual aid that we are not the only ones affected in the USA. Every country is affected. And in closing, ADHD is not a curable disease. With advancement of medication and therapies, though, hopefully we will be able to get new skills to better our lives with organization and therapy methods. Living with ADHD can be done. Prime example. Children can grow up to be productive. And as far as recapping, it is a neurodevelopmental disorder which affects the neurotransmission of the neurons in the receptors of the brain. We need to explore more treatment options. There are clinical studies available. And ADHD is not an excuse, but it is an explanation. So I'd like to leave you with that thought. And thank you for listening today to my speech, and I appreciate it.